nurse practitioner from Adams County Health Center. This morning's live feed is going to be on serological testing or antibody testing for COVID-19. Keep in mind that this is not the test that is given when someone is actively sick or actively showing symptoms. This is the test that is given after the fact. This test can be administered 2 weeks after the onset of diseases and then forward. It's nice for an individual to know if they have been infected. And I've had many patients say to me, I believe that I had the coronavirus in February. How can I find out? And others are just curious to know. Because keep in mind that a greater percent of the population actually shows mild or no symptoms at all, versus the people who are actively sick and have went in and had a test, or were actively sick and were suspicious that they definitely did have it. And so this is a way of telling people, yes, you were infected with the coronavirus, or no, you were not. But there are other reasons to do this antibody testing that is equally or even more important. One of them is disease surveillance. And what that does is it tells epidemiologists and government officials many different things. How many people, or what the percentage of a population has been infected with the virus? How deadly is the virus? What treatments have been working? What other things have worked to slow the spread of the virus? Who possibly could have been spreading the virus unknowingly? Another one would be therapeutics. So I'm sure a lot of you have heard about people that have been infected and then they have shared their blood with people who were gravely ill. What happens is if a person has antibodies to the coronavirus, if deemed necessary, they can use their convalescent plasma to be transfused into a gravely ill patient. We are doing this in the United States, but I had a hard time finding any results for that, but I did find some studies coming out of China, and the results were very promising. The other reason that we do antibody testing is for return to work. This was originally designed for medical personnel and first responders because it tells the company who has been infected, are they safe to return to work, could they possibly be put in with a group of patients that are currently infected and not have to worry about becoming infected themselves. And also they can be comfortable knowing that they're not going to be spreading the disease because they have already been infected. But that does lead me to the fact of just because you've had the coronavirus, if you have developed antibodies, that does not necessarily mean that you are immune to getting it again. This is a novel virus. This is a new virus, so that is still unknown. They are hoping that people are building an immunity. They just don't know, though, is that immunity good for 2 months or 6 months or 1 year or 2 years? As you notice, we will receive news in the morning, and by evening everything has changed. But at this point, they are hoping that people who have been infected are developing an immunity. So where can you get this test? In the state of Idaho, currently, there are 2 nonprofits that are performing the test in the Treasure Valley, and they have set dates throughout the state of Idaho to offer this test. We are bringing this test into Adams County Health Center. The cost of the test in the Treasure Valley ranges anywhere from $50 to $100. What I have found is that at this point, insurance is not covering the test. I cannot say that about individual insurance plans. The best thing that you can do is to call your insurance company and ask them, are you covering antibody testing? The answers I have gotten back are, call back in 2 weeks, we hope to be covering this, we can't cover it until it's FDA approved, so just talk with your insurance company. The plan for Adams County Health Center is that we have the tests on order. I don't know yet when we will receive these tests and when we will actually be testing, or what the cost of the test will be. But if you keep an eye on our Facebook page and our website, once we receive these tests and set up testing times and we know the cost, we will definitely be getting that information out, because we have a lot of people that are curious to know if they have been infected. The other thing that is important, it goes under the disease surveillance, is if you have a population that has tested and very few people are showing the antibody, that does mean that we are still at a higher risk of an outbreak. Keeping in mind, that's what we've been preventing. So I can see people saying, well, you told me to not get infected. You told me to socially distance and to stay home. And now you're saying we have such a small percentage in our community that we run a risk of an outbreak. But we did that because we were trying to lower the curve. That's what we were trying to do. And our whole goal is to not overburden our healthcare system so that as people become sick, they can actually be taken care of. So hopefully when we test Adams County, we find that we do not have a lot of people that have developed this antibody, and good for us for following the recommendations. Today at 11 a.m. Mountain Standard Time, Governor Little will be addressing our state in a press conference on economic recovery in Idaho. So I'm interested to hear what he has to say, and when we will all be getting back to somewhat of a normal, keeping in mind that nothing will ever return to how it was. We will have to continue being very mindful about hand washing, staying 6 feet apart, not gathering in large groups. So we will see what our governor has to say today. Thank you for joining me. If you have questions on antibody testing, please reach out to us. We are seeing we are seeing patients at the clinic. They are being screened in the parking lot first, and we continue to see patients virtually. So I'm seeing patients from home while the patients remain in their home. All you have to do is call the clinic 208-253-4242, and you will be given an appointment either at the clinic or a virtual appointment. Virtual appointments are done through the telephone or through the computer. They're quite easy and real effective, and you get to stay home while you have your appointment. I will see you next week. I will get a topic to you and a date and time, and we will continue fighting this coronavirus together. Thank you, and have a great day.